Hi, my name is Myriah. I'm a 39-year-old trans woman, a single parent, and a live streamer. I was born and raised in Olympia, Washington. My earliest memories that I felt out of place in who I was physically versus who I was as a person inside. So obviously as a child and feeling these feelings, you don't truly comprehend like what that means. And for me, I decided to harbor that inside of me and try to live the way that I was expected to live or I felt that I should be living. Up until I came out and started my transition, I was very ashamed of who I was. The majority of my life, I hated who I was. I was terrified of who I was. And so I held it in for a very long time. And it got to the point where I just didn't want to exist anymore. I just didn't feel the desire to continue on holding these things in. And being a single parent and having my children depend on me for basically everything. I'm their sole care provider. And I couldn't be that selfish. So I had to find a way to just learn to accept who I was. And in my darkest moments, I was able to start hormone replacement therapy and begin this journey that I'm on that has been so beautiful and so fulfilling. Once I started HRT, I still didn't have the courage to come out and tell people what I was doing, how I felt, who I was. And so the first 9 months of hormone replacement therapy, I continued to keep it hidden. As physical changes and things were happening, I was trying to keep people from knowing because I was absolutely terrified of coming out and being judged and what people would think of me. In my journey of coming out, my kids were absolutely the most supportive, encouraging, inspirational people I could have ever had in my life. From the first day I told them and their excitement to see me do my makeup for the first time and fighting over who got to see me first. And it was just the most beautiful experience I could have ever imagined. And my children, as much as they helped me start this journey, I was scared for them to begin the journey because of what they might have to go through. So being a single parent is already a huge endeavor on its own. When you throw in the fact that you're trans and you're their parent, you're the one that's going to the basketball games, the school conferences, all these things that every other parent's going to, but then you have to throw in that I'm trans, like I stick out a little, I'm different than your average parent. It's kind of funny because a lot of times people will just automatically assume to call me mom. And me and my children, when I first came out, we talked about this, and I've always been their dad. They're a little bit older. They have a mother, so we felt for me and for them the best thing was just to keep that the way it's always been and keep things as normal as can be for my children, you know? I get a lot of questions doing my job as a live streamer. What is a woman? What does femininity mean to you? It's so much deeper than just saying makeup and nails and pink everywhere. It's who you are deep inside of you, like who you truly feel you are. And it's somebody that isn't trans, it comes so naturally to them, and it's nothing they would ever like think about or contemplate or like know what that feeling is. because they have an alignment. I don't have that alignment. So interesting enough, I actually originally heard about Dr. Sajin from one of my viewers on my live streams. They had a friend that had gone to him and they told me to check him out. So I went and followed him on TikTok and Snapchat and all the different social medias, and just started watching him and reading reviews, and eventually I got to the point that I was like, this is the guy. I feel comfortable, and I haven't even met him, you know. Being a single parent, working full time, I was trying to avoid the awkward stage as much as possible. That is another reason that I waited 9 months after starting HRT to come out, to try to get as far along in the process, so that when I did come out and I did start presenting female, that it would be less of an awkward stage for me. So immediately after I came out, within a month, I flew to San Francisco, I got my eyebrows tattooed, and I got my lips tattooed, which gave me this huge boost of confidence. Such a simple thing gave me the biggest boost of confidence I could have imagined. And it was a couple months after that that I had my first procedure done. I had a breast augmentation December of 2022, about 2 years ago. And that again was just another giant confidence boost. It's just unexplainable the way that can boost how you feel about yourself. And it's really weighed on me my entire life, my body, how I feel about my body. Obviously, as a trans person, like, you really like feel this to the core. So getting a BBL, getting Lipo 360, it's so much more than just getting a BBL. It's feminizing my body that I've had to stare at for my entire life and feel like that's not what should be in the mirror when I look, you know? So it's so much more than just like a cosmetic procedure. To me, it's like a gender affirming procedure that belongs in the journey that I'm on. I think if I could go back and talk to myself, I would tell myself, don't be scared. Don't be ashamed. Be proud. Be unapologetic. Be courageous. Don't live your life in the expectations of others. Live your life for you and who you are and your happiness. So leading into transition and coming out, I was so terrified of the way people would think of me, the way people would treat me out in public in my everyday life, how my family would react. Thankfully, everybody in my life and every experience I've had has been absolutely amazing. Now I do, on the other hand, receive a lot of hate in my job. I broadcast my life out to the world on a daily basis, and you find that people behind their screens, not looking you in the eyes, have a lot more courage to say those evil things, tell you those horrible things. It has even gone as far as receiving messages, death threats, like threatening my personal well-being. And at the end of the day, nothing's gonna stop me from living my life the way I live my life. I am absolutely proud of who I am and where I've come from. And I will never allow somebody that holds no value in my life to affect my life in a negative way with their words, with their opinions, because their value to me is nothing. My value to myself, my children, my family is everything. So I live stream every single day, anywhere from 6 to 12 hours a day. You can find me live streaming. I don't take a lot of days off, and I think that's one of the most important parts of my success, is being consistent. So obviously I started out with nothing. I had nothing. I've managed to work myself up. I have 75,000 followers now. I've gotten as many as 6.6 thousand people in my live watching me at one time. I've had the opportunity to be a part of Pride events, that are hosted on the main account of TikTok. And the best part about it is I actually enjoy it. I get to do what I want, when I want. I set my hours. I take time off when I want. I can take my kids to school, pick my kids up, go to basketball. Like, I have so much flexibility in being able to do this that it has really just allowed me to basically do whatever I want or whatever my kids need. Oh, hell, you're filming me? What the? Okay, let's, I'm going to do my pads. Feel good. I'm a little bit anxious, a little bit nervous, but I slept really good. I feel good. I feel confident. I'm ready. And I got my amazing friend Sin here.
She has won over so many people on TikTok. She's been an inspiration for others that are trans, like Skylar and them. She's made a mark, I mean, in the trans community, because she'll get a bunch of haters in there, and she keeps talking to them, and then they end up like being a follower of hers and following her and cheering her on, when in the beginning they were so hateful.
Myriah?
How are you?
I'm good, how are you?
Good.
All right, hi. Come on and follow me back this way. My name's Kayla, I'm gonna be the nurse helping out today. Nice to meet you both. And we are gonna go right into this first room here.
Your picture. This is Myriah. We are doing vaser lipo of upper mid lower abdomen, upper mid lower back, waist and hips with a Brazilian butt lift with J plasma and PRP.
Excellent. Thank you. Hello. How you doing, Myriah? So excited to see you.
Good to see you.
It's an amazing day.
Sick day.
We're going to do amazing work for you, I promise, okay? Thanks for working with our team. They loved hanging out with you. Did you enjoy your day?
I had an amazing time.
Oh, cool.
Yeah, we had an amazing time. It was great.
Awesome.
Everyone's been absolutely amazing. I give all props to you for creating this team because they're amazing.
Thank you. Thank you.
I feel very good in your hands.
It's our privilege. We're happy to have you. We're going to do good work. We're going to lipo 360. We're going to bring that waist in. We're going to make the stomach flat, make the back into a nice swoop, fill in the hip dips, make the buttock nice and full. Questions?
Nope.
Awesome.
All questions have been answered.
The challenge with our case is she also has some loose skin. So if I do this surgery traditionally, take a big hose, suck fat out, I'm gonna get lumps, bumps, and divots, and putting big fat pieces in the buttock for high volume transfer, that's what we're gonna do, doesn't work well because I feel the fat doesn't survive as well. So what we're doing in our amazing patient today is my special liposuction technique. First, we're gonna use an ultrasonic probe to break up all the fat. This is 3-step lipo technique. Use the ultrasonic probe to break up all the fat. Step 1. Step 2. Instead of using a big tube with holes in it to suck the fat out, we're going to use special tubes that move back and forth to suck the fat. After that, we're going to have some loose skin. What we're going to do for that is we're going to inject a helium probe under the skin, expand the skin with helium, and then shrink it with plasma by heating it to 85 degrees. Once that's done, we'll take the fat, we'll process it in our special way, we'll then inject it with a special tube that I have that doesn't inject from the end but from the side to prevent and decrease the risk of embolism. Embolism can cause death. We'll inject the fat in the hips, upper shelf, mid shelf, and lower buttock to give her something that's going to be the center of gravity. Right now, when you look at her backside, the lower back and buttock is one unit. The hips aren't existing there. The love handles blend with everything. For my body contouring procedure, I want the body to have distinct areas, distinct regions. The love handles are going to come in. The hips are going to come out. The buttock is going to project. The back is going to swoop beautifully into the buttock like that. Let's do it. All right, friends, our first step is we're going to liposuction the side. We're going with our ultrasonic probe. On, please. All right, friends, we're going to use helium plasma skin tightening. The liposuction is done perfectly. Nice waist. Stomach is flat. We're going to test this. It's working. So to remember, the liposuction I do has 3 steps. Step 1, ultrasonic, break up the fat. Step 2, suck out the fat. And step 3, tighten the skin. So we're in the skin tightening phase now. I do it in a very methodical, stepwise fashion in a controlled way to give the patient the best result. All right, guys, we did it. What did we do? Lipo front only. It's still a lot of work left, but we've done the front. We did ultrasonic fat disruption. We did power-assisted lipo, then we did helium plasma skin tightening. It's swollen, it's going to heal, but look where we are now. The waist is snatched, stomach is flat, love handles are gone. Wait till we finish this. How you doing? Your surgery went amazing. And that shaking is the anesthesia still in your system. We're gonna get the warmers on, and you're gonna get nice and cozy, okay? Surgery went amazing. There were no complications. We put in over 3,600 cc's of fat. Okay, we're gonna get you taken care of. You did amazing. Congratulations.
We have about 10 more minutes of recovery left, and then we're gonna start taking your IV out, getting you ready to go. All right, your caregiver is here. So I'm gonna let them know to bring the car around. Of course, you're welcome. Strong legs, stay right there, okay?
Oh, hey, I'm down today.
Hmm?
I'm down today.
You are, yeah. Just like that. Yep, stand up nice and tall. Breathe out, out, out. Yay, you did it. You got it. Do you need to adjust yourself or you're okay? All right. How's the nausea?
It's okay.
Okay, good. Put the seatbelt on you. Yeah, when you get to your hotel, small sips, okay? But now that you're gonna be in the, how do you recline this back? This chair. I don't see a button. Oh! Are you okay?
What the hell, girl?
Give me your hand.
Are you okay?
She's okay.
Okay.
Hit that button. Get her.
Sorry. I don't...
Hi, checking in.
Myriah.
Great. Allow me one moment to get you checked in. How's your day going, Myriah?
Rough. It's a little rough.
I'm sorry to hear that. Alrighty, I will.
Myriah? Hi. Hi. We're actually gonna go just around the corner over here. Myriah, you had just your surgery yesterday, right?
Yeah.
How was the past 24 hours? Rough. And a lot of pain? Okay.
A lot of muscle soreness. I don't have like a lot of like movement, you know.
Okay.
Lifting up my legs hurts.
Mm-hmm.
Everything hurts.
Mariah one day out from a BBL. She is feeling a lot of pain right now, but she's looking great. She's very excited. She is taking all of her antibiotics. She's taking all of her meds, but she just wants to know what else she can do for the pain.
Of course. Let's go see her. Hello, Myriah. I'm sorry you're hurting, but you look amazing. Only one day out. Do you see a difference?
Oh yeah, I see a huge difference.
And the real difference is going to be here in 3 months, when your skin shrinks and everything comes together. And we're going to help you with the pain today. Don't worry, we have a plan, okay? So we're going to take a gentle look, and I want to check your skin, make sure it's okay. I'm going to decide on what I'm going to do with compression too, okay? Are you walking?
Yeah, I get up like once an hour and
Good.
walk around.
Good. One of the risks is a blood clot, so we got to
I can't
walk.
sit though. I can't use that pillow. Like, I don't have the mobility in my legs to like.
It'll come back. It just needs some time. It takes about a week or so. So if you're on your stomach or standing, that's good. But no sitting on the side, or you'll get hip dips, okay? So overall, we're doing great. Things are healing. We're gonna give you a special wash to wash your skin with. You can just comp the wash, okay? And then once we take all the tubes out, I'll give you ointment. You feel like you're gonna faint?
No, I just felt weird.
Okay. So we'll get you a wash and we'll get you ointment, okay?
My suggestion: you don't need a BBL, buddy. That's my suggestion.
Pulling up the car.
You're supposed to, yeah. Be for real. So right after the surgery, like the following day at the post-op, it was very rough. Like looking back, I don't really like remember a lot of it. I think like the anesthesia and stuff, like it's kind of like a blur. But I remember being in this room and like, I don't know, I remember like panicking kind of, and I was just leaking everywhere, and it was kind of crazy. Since then, recovery has been pretty tough. There's nothing easy about it. Sleeping's been rough. I've been sleeping like, I'd sleep a few hours, get up and like do my little walks, go back down to sleep for a few hours and get up and like do my little walks around the house and stuff. It's gotten better, but the more that it's gotten better, the more like the drains I had in me like bothered me. And I was so excited today. I've been counting down the hours for the last like 36 hours to come here and get my drains out. And having them out and having the pad off of me, it feels so amazing. It's such a relief. Like results-wise, I'm blown away by how my belly looks. I never in a million years would imagine having this flat of a belly. Obviously, I got a lot of curves that are still gonna like work themselves out. But I couldn't be happier, honestly. He did such an amazing job. Like, I just can't believe how good of a job he did, to be honest with you guys. I'm so happy.
Myriah. Hi, how you doing today?
Good, how are you?
I'm good, thank you. We're gonna head on this way. Right in here. Awesome. Perfect. How's everything going for you?
Pretty good.
Good. I'm gonna go ahead and let you get changed. That disposable thong is there for you. You can keep your bra on if you'd like. And then that gown's there for you as well.
Okay, sounds good.
Awesome. We'll be back. Thank you.
Hello, Myriah. How you doing?
Good, how are
You're looking amazing. Wow. The stomach skin is flattening out much better than expected, with no tummy tuck.
The amount of like skin tightening you got is like miraculous to me,
Thank
to
you.
be honest.
My pleasure. Yeah, we did a special technique where I used ultrasonic energy to break up the fat, and then I used helium plasma to shrink it. It's very dramatic. Can we take off the gown?
Very well.
Thank you. Good. And you're wearing the garment right now?
Yeah.
Is it tight now or loose?
I just started on the large size.
Oh, good.
Last Friday.
And what level do you have it on? The first,
The
second?
tightest one.
Okay. Good, let's
I
look.
almost feel like it could go tighter, but I don't know like how tight really it needs to be.
Yeah, I'll give you something a little better. Let's look at the side, please. Let's look at the other side, please. Good. I'm checking for any blood or fluid, nothing. Let's look at the back, please. Thank you, Myriah. Amazing. Yeah, so what I'll do is this. Keep that going because it's tight enough. And I'm going to have them give you a waist trainer. Now, the waist trainers run a little small. So I'll have them, Tina, can you see what's better for her, large or extra large? I think it'll be XL. Great, buttock looks perfect. It's going to get more round. It's healing exactly how we want. Congratulations. We love you, okay? We're going to see you in 1 month and make sure you're on track.
So we made it. I'm 2 months post-op. Overall, I feel mostly healed. I do have a little bit of like soreness and stuff. If I stay in one position too long, like getting up, I like have to stretch. It's mainly like the liposuction areas that I'm still like feeling. The biggest thing was what I kind of just talked about and like what I was seeing in the mirror, like right after surgery, and how like extreme everything looked because it was so big. Like obviously you lose a lot of the fat that's transferred, but like seeing it in real life, it was kind of a struggle mentally to like get myself to understand and just trust the process and be patient. The recovery in that first week, I don't know if it was really mentally challenging. I guess in a way, because of all the physical challenges, it weighed on me mentally, but I just slept. That's how I got through it, I just slept. I think I've said this before, but the first 8 days, the drains, when you ask that question, I think of the drains. They just like haunt me. Having those drains in me and like having to lay on them and try to be comfortable with the drains was very difficult. There's the funny thing about like that first week of recovery and having the drains, like going in, I didn't know how to have to wear a diaper, and then I got out and I was wearing a diaper and I'm like, what is this? But I became so dependent on that diaper, like it was a source of like comfort for me. And like once I got the drains out, I was still like, I want my diaper. I think I wore a diaper for like a day after I got my drains out just because I didn't want to part with it. Going in, I knew that I was gonna be overfilled and things were gonna be bigger than like what they would be when the process was all over and I was all healed. But my kids and my mom didn't really like understand that part of the process. And even my daughter one day, she was like, girl, that thing is so big. And I was just trying to tell them, relax, relax, it'll settle. So I catch myself like, just like staring at myself in awe all the time. I'll be on live and I'll just be like looking at like just sitting down, like seeing like my hips go out and my waist sucked in, like the hourglass figure that I never dreamed would be possible in the way that it is, and it's so amazing. I don't know if it's like changed who I am, but it definitely has lessened like the gender dysphoria that I had. And a huge part of my gender dysphoria was based around like my body and my shape and trying to like find clothes to like hide and make it look like the shape that I have now. It was so difficult, and now I just like, I don't know, I'll put clothes on that I would have never worn before and I just feel amazing in them. Like, it's definitely like boosted my confidence. I couldn't imagine anything else that would boost my confidence the way that this has boosted my confidence. So TikTok, to me, this app is, it's such an amazing place that anybody can build a platform and a community from. And I've been doing this for a couple years now, and there's been countless times where people will come in and tell me that I've literally like saved them from doing horrible things to themselves, and like trying to grasp how little old simple me could have an impact on people like that it's such a surreal experience. If I lost TikTok today, I would be in serious future financial jeopardy. 100% of what I earn comes from live streaming. It would definitely create a huge hardship on myself and, more importantly, my children. But everything happens for a reason, honestly. And I've learned through life, you may get set back, you may have struggles, you may take steps back, but when you come back and you get back on your feet, it's always been, for me, it's always been better than it was before. So just maintaining a positive attitude and a positive outlook, I think is very important, because really you never know what the future holds. Anything could happen at any time. This is part of why I was scared to transition. I didn't start transitioning until I was 36, was just being scared of what everybody else would think around me and going out in public. Like the first time going out in public with like makeup and hair done and stuff was so nerve-wracking. Thankfully for me and my journey, I've yet to have any negative experience or get weird looks or have somebody make like a rude comment. I've obviously like been misgendered, and I know for a lot of people that's like, it's really heartbreaking for a lot of trans people to be misgendered, but I try to like take a step back and like see things through like a wider perspective and not just my narrow perspective. Like to me, when I'm out in public and you see me, I feel like I present feminine enough for someone to make the assumption of what my pronouns should be. But then I have a deeper voice than a cis woman has. And so like when I'm talking to somebody and they use he, him pronouns, I just kind of go about my business. Like I know who I am. A simple thing like that like affect my energy. And the majority of time, people don't do it on purpose. Like they're not out there to like misgender you and make you feel like crap. Like it's just like an accident. Your brain like automatically hears a deeper toned voice and it just goes to he, him pronouns. So obviously if you have like the ability and the resources and a path to getting a procedure like this done, and you're just nervous or you're scared, I 100% would say to trust your heart and go with what you think's gonna make you feel better. Obviously everybody's gonna be nervous, everybody's gonna be scared, but as long as you go in knowing what to expect, and I absolutely think that it is worth doing these procedures, and I wish all trans people could get the procedures they want. If I could go back and talk to myself before I started this journey that I've just gone through, I would tell myself to trust the process, to be brave, to not be scared. I was very scared, like leading up to the surgery, I was so scared, and like there's so much out there about like the BBL procedure being like dangerous, and everyone's like, don't do it, don't do it. I had done my research and I was very confident in Dr. Sajan, and I knew I was in good hands, but it's still like you hear all these things about how dangerous it can be, and in the back of your head, you're always thinking. And obviously like going in for your consultation, the doctor has to be honest, and there is a risk of death doing a procedure like this, but it's so minuscule. And when you look at like the big picture in life, I think is very important for me going in. So gender affirming like procedures are very like personal like matters, and they're very scary and very controversial. Part of the reason that I agreed to this, besides the fact that I do like social media for a living, is just to like bring awareness to people like me. A big part of why I do social media is to try to like humanize my community, because it's so easy for people to not do that and not look at us as just another human. And that's like the core of everything that I do when I put myself out there, is just trying to show people that we're human like anybody else. We're all equal. We all come into this world the same. We all leave this world the same. We're all struggling to live happy, fulfilling lives. And I think just like being myself and my personality and my sense of humor makes so that I'm able to leave an impression on people and maybe change people's perception of what it's like to be a trans person.